Hi there. Merry Christmas and Happy New Year to you all. As usual, I'm here to tell you a few things about your health and diseases so that you can make smart choices and live healthier. Today, I'll be talking about gastroesophageal reflux disease, which is a disease characterized by regurgitation of stomach contents into the esophagus. The esophagus is simply, the tube at the back of the throat that runs down to the stomach. So, gastroesophageal reflux disease is when you have contents in the stomach going into the esophagus. And this can happen when there are pressure differences at the lower esophageal sphincter. The lower esophageal sphincter should normally prevent backflow, regurgitation of contents of the stomach into the esophagus. But due to certain disease conditions, this can happen whereby you have regurgitation of stomach contents into the esophagus. That's some of the risk factors for gastroesophageal reflux disease: obesity, eating heavy meals, eating too close to your bedtime, eating food that's excessively spiced, alcohol consumption, cigarette smoking. What are some of the symptoms of gastroesophageal reflux disease? So heartburn is number one. So you have this pain, like a burning sensation from the stomach going up. That's heartburn. You can have angina, like chest pain. You can have what we call a water brush, so excessive salivation, like hypersalivation. You have what we call a globus, so there is a sensation of something stuck in the throat. You can also have extra esophageal symptoms, so symptoms which are not in the esophagus, like cough. Okay, so persistent coughing sometimes can be due to gastroesophageal reflux disease. So what can we do to prevent gastroesophageal reflux disease? If you have the symptoms, of course, I always say you should see your clinician. Avoid eating heavy meals. Avoid eating too close to your bedtime. Stop smoking. You want to cut down on your alcohol consumption, and of course, you want to look out for your weight. There are certain alarm features which warrants further investigation to rule out complications. Right? What are some of the alarm features? Pain on swallowing. You're having difficulty in swallowing. Signs of upper gastrointestinal bleeding, right? Like vomiting blood. Anemia, like iron deficiency anemia. Unintentional weight loss, right? These are alarm features because something may be going wrong. And what are those things that could go wrong? Barrett's esophagus, and you can have an esophageal cancer. The stomach is rich in acid. So repetitive exposure of the esophagus to gastric acid provokes inflammation, provokes erosion, and this can, cause some cellular changes within the esophagus, which can, over a long time, predispose to esophageal cancer. So I hope